So this is chapter 26, students. Stress and associated problems. Let's get started. Stress, we know over 40% of adults experience adverse effects from stress. I would think that number would be much higher. Stress responses. Homeostasis, where your body is trying to compensate to minor changes in needs of the environment. The stressor is the whatever creates the change in the body function. And then severe or prolonged stress can cause dysfunction, wear and tear on tissues, exhaustion of resources, exacerbations of chronic conditions. The General Adaptation Syndrome, GAS. I know that y'all studied this in high school and other college courses just like I did. But know the stages of the GAS. The alarm stage, where all the defenses are mobilized. Get the forces out there and reinforce, back up. The hypothalamus, the sympathetic nervous system, the adrenal glands, all mobilize in the alarm stage. And then there's the resistance stage, the elevation of hormone levels, where the body systems operate at peak performance right now. Everybody is at attention and ready to do their job. And then the final stage is resolution or death. Effects of the stress response can be things like elevated blood pressure, increased heart rate, bronchodilation, increased ventilation, increased blood glucose levels, arousal of the central nervous system, and changes in the inflammatory and immune responses. Those may decrease so that your ability to deal with stress may be compromised too. The stress response, now this is out of your book. Go back and look at it up close and personal. This is a small little version, but look at the stressors, and the CNS is activated. The hypothalamus comes into play. Look at the things going on across here. Look at down at the very bottom, possible complications: hypertension, tension headaches, insomnia, diabetes, infection. Everybody's system can be affected there. Specific problems. Headaches can develop during a stress or after a stress. If you've been stressed, then you know that tension that you have. And then when that tension is gone, you have a headache. Stomatitis, these are the ulcers that happen in your mouth. If you've ever had one ulcer in your mouth, then you know that it is debilitating completely. So imagine having more than one in your mouth. Necrotizing periodontal disease is something else. Prolonged vasoconstriction, which can impair function and cause necrosis in the GI tract or the kidneys. Things are going to be vasoconstricted, and major body organs, the fight or flight. Think about everything that's you have to have at the moment is going to get the supply, and your GI tract and your kidneys may not get blood in this vasoconstrictive process. Precipitating factors: chronic infections, and then emotional distress or physical distress otherwise. Examples of stress-related disorders: look at all the body systems, and there are probably others. Why do I start yawning every time I start doing this? I'm so sorry. Please forgive me. Side effects of prolonged or severe stress: we saw the renal failure, the vasoconstriction that is happening there, and ischemia that causes the cell damage. Stress ulcers from the vasoconstriction and the glucocorticoids that are being released. Decrease in mucosal regeneration and mucus production. Everything dries up, doesn't it? Infection, depression of the inflammatory immune response. We really already said all of these things. Potential effects of prolonged or severe stress: slowed healing after trauma or surgery, especially increased secretion of glucocorticoids, reduction in protein synthesis and tissue regeneration, increased catecholamine levels, vasoconstriction, reduce nutrients and oxygen to the tissues. So vasoconstriction ends up being an issue in prolonged stress. Post-traumatic stress disorder. We hear a lot about this right now, especially related to soldiers, related to people who have been in bombings or shootings, things like that. It is a very serious consequence of any major disaster or personal threat. It can occur within 3 months of the event and cause symptoms even years after that. Now, a person with PTSD has a higher risk of developing drug or alcohol dependence, and we've seen that quite a bit. Coping with stress. How do we cope? Well, we stay rested and healthy. Healthy diet, healthy activities, good night's sleep. We can use creative solutions to minimize stressors. You've got to have coping mechanisms in place that work. Moderate, regular exercise. Distraction is a wonderful tool for dealing with stress. We use distraction in children. If you're in nursing, we can distract a child. I can distract a child when I draw blood. Usually use a little butterfly on a child, and I can draw blood. And so I will tell him we're looking for the choo-choo train. And he can watch that little piece of tubing for the choo-choo train. And when the choo-choo train starts backing up, we'll say, woo-hoo, and watch the train. We'll draw the blood that we need. And then I'll usually flush it with a little bit of saline. And if we blow the train away, if he blows the train away, as I flush, see, then he's blowing the train away. And they love to do that. And so we've completely distracted them from the point that they got stuck. Counseling and support services and lots of relaxation techniques. Some of you may have done some of these. Look some up on the internet because you can use them with your patients. I use a tensing and relaxing exercise where you lie down and you get as comfortable and still and relaxed as you can. And then you start with your head. And you tense every muscle that you can in your head, just as tight and as tense, and hold it just as tight as you can. Hold every muscle tense, and then relax it. And feel that warm feeling flush over you as you relax. That's the feeling of relaxation. And then do it with another body part. Do your arms. Tense every muscle in your arms and shoulders, just as tight as you can tense them. Tight as you can tense them. And then let go and relax. And feel that warm feeling, feel that tingly feeling. That's relaxation. And that's what people need to learn. We need to get to that point of the warm, relaxed, tingly sensation. And you can look at some of these online and you can practice just the tensing and relaxing. Start at your head, go all the way to your toes, and then your whole body tense and relax. Tense, hold it to a count of 10, relax everything. Feel the relaxation. It works pretty well. You'll go to sleep. Okay, I already did chapter 27 in another set, so I am stopping here.